I'm Dr. Mark Kerner. I'm an orthopedic spine surgeon here in Newport News and Suffolk. I take care of people's back problems, whether it's neck, thoracic, or lumbar spine, any type of back injury or complaints related to the spine, I evaluate and treat. I've been in this area for 27 years now and taking care of thousands of people. I'm a surgeon, so I take care of surgical problems, but our emphasis is in trying to get people the simplest and safest way possible, which generally is non-operative care. So for most people and most problems don't require my services as a surgeon. They require therapy, exercise, habit changing, and time, and sometimes medications or injections. And that's what gets most people better. I've always been fascinated by the spine and how it works. And back pain and injuries to the spine are very much at our core and very disabling to people. When their backs hurt, they can't work, they can't function, it affects their families. 3 decades I've been able to treat thousands of people and change a lot of lives for the better. So I found it a very happy career. I find the Hampton Roads area has an interesting diversity of people from different locations. About a third of people actually are from Hampton Roads. Almost everyone else is from someplace else and have landed here, whether they're from industry or the military. And it's a nice place to raise a family. So I have a large blended family of 7 children, and they've all found different ways to enjoy themselves in the area and become successful in their own right. The most challenging part of spine surgery is the diagnosis, whether you've had surgery or have not had surgery in the past. The main cause for a problematic outcome after a surgery or a surgery that doesn't go well for somebody is actually a question of what was wrong with them to begin with and whether you were fixing what was broken. And so I find the biggest challenge in meeting people is to figure out what's wrong with them anatomically, what's bothering them and how it actually affects their lives, because not only do you have to fix the problem, but the problem that you're fixing has to actually relate to the problem that they're feeling. And sometimes those are 2 totally separate issues. If I'm taking care of a world-class athlete and they have a problem and success to them is being able to play Major League Baseball, well, that's one type of answer I have to give them, and that's different than a banker or somebody who does a clerical job where fixing them means they just have to be able to sit behind a desk. And then you have to figure out the time frame. I have patients who come to me and they're eager to work, and they have to work for another 3 years so they can reach retirement, and that's their goal. I have other people who are eager to have some sort of treatment done so they can dance at their child's wedding. And so it's not only fixing the problem, it's fixing it in the context of their life so that you can achieve for them what they want and having them understand that. A lot of what I end up talking to patients about is trying to figure out what their goals are and try to set their expectations appropriately so that I can succeed. Part of what I do is trying to give people pretty x-rays, but the most important thing is to try to make them happier with their lives and that I've actually provided them what they're looking for.